Okay, this is a video competency. You don't have to do a paper competency on how to perform breathing treatment, but if you end up working in a pediatric office, a pulmonologist's office, family practice, or internal medicine, you may be asked to do this procedure. So it's important that you kind of know the steps. All right, so to start with, you normally would wash your hands, you'd have your patient, your physician would order how much medication that he wants the patient to have for this breathing treatment. So the equipment that we need to gather for this is your pulmonade or nebulizer machine. It may be called various things. This particular machine is what we're going to use in here. This stuff here usually comes in a kit that you'll have to assemble, so I'm going to show you how to assemble that, and you should do some hands-on in class with that as well. This has a tubing. This tubing, both ends are the same. It has a medication cup, a lid, and then a mouthpiece, so we'll put that together. And then we also have the medication. So here's our albuterol medication. And then sometimes you'll also have pre-packaged medication where it's already measured out for you. So we'll kind of look a little bit at both. All right, so the first thing that we're going to do is, let's say the doctor has ordered a breathing treatment with 0.5 cc's of albuterol medication. So what we want to do is assemble the medication cup and put the medication in the medication cup. Again, both ends are the same, so it doesn't matter which one we put one on the machine. And what the machine does is it takes the liquid and it turns it into vapor. Then we're going to take the medication cup. Some of them are graduated like this, where you can kind of see how many cc's that this medication cup holds. Some are not, so we are going to measure this out on our own. So to fill the medication cup, I have my albuterol medication, and we said that he said 0.5 cc's, so I'm going to take my medication, I'm going to open it, and then again you can see on here how we have 0.5 and 0.25. All right, so I'm going to take this down to where it's straight up, and the meniscus is right at the bevel for 0.5 milliliters or 0.5 cc's, and I'm going to take that and I'm going to put it in the medication cup. So I just simply put that inside of the medication cup. Okay, now set that down to show you. This is just saline in here. So for this also has measurements on here. So this is pre-measured 3 cc's of saline. Okay, so the medication needs to have the saline to interact together. For this, I'm just going to twist off the top and I'm going to squirt that medication right into the medication cup with the medicine. Put the lid back on my albuterol. So I have my medication in the medication cup. I'm going to put the lid on, screw it on nice and tight. Then I put the mouthpiece on, and now it's ready for the patient. The patient's going to put their mouth on this side of it, and I'm going to put the other end of the tube on the bottom. Now it's ready to go. Okay, so that's how we assemble the medication cup portion and put the medication in. Now what I'm going to do is I'm going to go to my patient and tell my patient, explain the procedure. The doctor's ordered breathing treatment for you. I probably have already worked this patient up and gotten her vital signs and verified her date of birth. So the next thing that I'm going to do is explain to my patient what is going to happen is this is going to make a motor-like noise and it's going to produce like a vapor, okay? I want you to put your mouth on here and just breathe normal in through your mouth and out through your nose until all of the medication is gone, okay? So then I need to turn my machine on, and there's that motor-like noise. We can see the vapor, all right? So I would give this then to my patient. You're not going to do this. Give this to my patient, have my patient, turn this off so you can hear me. I have my patient put their mouth on there, breathe in through their mouth, out through their nose. One other thing that's really important is a lot of times albuterol will make the patient a little jittery. So it's a good idea to check the patient's blood pressure afterwards, and their hands may shake a little bit. No, that's somewhat normal. Now, if the patient's really not feeling well after the treatment, then you need to let the physician know. But I think it's important for you to know that the patient will have a little bit of a shake afterwards. It's just kind of a side effect of the medication. Now, when this is almost done, you can see kind of the liquid in there. That liquid will go down, and it doesn't seem to be as much vapor coming out. If you give the cup a little shake, you'll get a little more medication out, and you want the patient to get the full effect of the medication. Okay? All right, so I'm going to disassemble this so that you can kind of see. Again, the mouthpiece comes off. The medicine cup, some of them snap on, some of them screw off. And then we have tubing that goes to the medication cup and to the thing. All of this is disposable, and then this just closes back up and we put it away for future use. Okay, so documentation for a breathing treatment then is what we're going to do is, like always, make sure the patient's name and date of birth is on here, the date and time, nebulizer treatment, breathing treatment, either one is acceptable, was given, and I'm going to put how much medication. I had 0.5 cc's of albuterol with 3 cc's of saline. My patient tolerated the treatment well, and the treatment was over. We started it at 12:15 and it was over at 12:32. Okay, so, and I already have in here that they tolerated well. My patient was fine after the medication treatment, and then always I want to sign first initial, last name, and my credentials.